Hey, today from today till I don't know when, I forgot the date. We're gonna learn myofascial trigger point release. That's a full form of trigger point release. So this is one of my favorite therapeutical thing. I like this very much. That's why I did masters in it. Uh, so I don't like the other things like dry needling and then cupping. Don't take me wrong for it. I didn't like it personally. That's it. So this is basically what is it? When a client comes, if a client complains of any pain or anything, we'll think like any injuries, arthritis, or any nerve problems behind it. We don't go behind muscle problem, whether a muscle tightness is there. We'll just do stretches and just leave it. That's what we were doing. So the muscle release is an ultimate thing, or myofascial trigger point release is an ultimate thing, which will make client or patient to feel better as sooner when compared to the stretches. So that's the main point of myofascial trigger point release. And then mostly 75% common problems are caused by muscle tightness. That's a study which has come in. So the 75% problem which are seeing in day-to-day life, these all because of muscle tightness, only because of muscle tightness. Okay. So what is trigger point? The perfect definition for it is in a layman term, it's a small tight knot. It's a small tight knot which is present in the muscle fibers. I'll tell you the medical name for muscle fibers. So it's a small tight knot which is present in the muscle fibers, which causes pain either locally or because of a key trigger point. It may be occur in another part of the body. This is the layman term definition. When it comes to the exact medical term definition, it's a trigger point is the hyperirritable spot which happens between the muscle or inside the muscle, exactly over the sarcomere. That's called muscle fiber, exactly the sarcomere, which doesn't relieve the actin and myosin binding. This is the exact medical definition for trigger point therapy or trigger point release, or trigger point we can call it as like. So this is the definition. I'll give you two examples for it. You can take it as a sciatica. So sciatica can be caused due to either, it can be caused also because of your disc prolapse, and the second cause can be because of your piriformis also. So the piriformis is where that muscle tightness is there, but sometimes you won't feel the pain over the piriformis muscle. You will feel the radiating pain towards your lower limb, one leg. So that's the one example for it. The second example is your headache. Have you seen whether the client is having any vertigo or any headache, migraine problem? Mostly I have seen nowadays are doing it, even myself doing it. When I release their trapezius, levatas scapulae, both upper, middle, lower trapezius, levatas scapulae, the headache will go like this. And then the subaxial muscles, the headache will go in a session. That's it. The vertigo will go in a session. So not everything is related to the medical conditions. Maybe because of imbalanced fluid in their ears, it could cause vertigo. It's not like that. There's another perspective where the muscles also will cause these symptoms. So this is the two ultimate example for what is trigger point, how it can be felt or how it can be seen. Okay. And then there's a thing which everyone should learn, because if I talk about that, it will take a longer time. Coupling mechanism. So coupling mechanism of a muscle. So that everyone should learn. If you learn it, you can understand this more scientifically in an easier way.
What's the spelling?
Coupling.
C-U-P-L-I-N-G.
Coupling mechanism. So in that there are two things: thin filament, thick filament, actin, myosin. Okay. So how the muscle contraction will happen when the actin is binding with the myosin head. So that's how the muscle contraction happens. So this trigger point, what is happening is the contracted muscle is not being relaxed, or the contracted part of the muscle is not being relaxed. So how the pain occurs, if it's not being relaxed, the other parts of the muscles are being stretched a lot to do that movement. That's why you can see my range is only this much. I can't go beyond this because my infraspinatus or subscapular is tight. So these are the things which you can notice in the clients. So it's a particular part or not which is shortened, a muscle which is shortened. Because of that, you can't able to do the movement. The shortened part is your actin and myosin, which is binded, which is not getting relieved. Usually it will get relieved because of that chemical reaction which is happening to myosin. That all can be read in coupling mechanism, which if you see that video or you see the video which are available in YouTube, you can learn it very easily in that. So this is the coupling mechanism and trigger point scientifically which is happening. A permanent shortening of actin myosin filament or a permanent contact of actin myosin filament which will lead to trigger pain or trigger point. That's the exact definition for your trigger point in the physiological process. Okay. The next topic is about types of trigger points. So, trigger points shouldn't have to be always active. It can be subtle. It cannot be felt. So there are mainly three types. The first one is your active trigger point. The second one is latent trigger point. Third is satellite. The fourth one is that's a key trigger point that will come on a satellite trigger point. I'll just explain. So the first is active trigger point. The client will have the pain always. They'll always come out of the pain. You can take neck pain as well as you can take knee pain. And knee pain is caused by major osteoarthritis or quadriceps, your calf, your hamstrings. These are the things which is causing osteoarthritis, tightness. So they'll have a pain always. Okay, it's because it's active. The trigger point is active. Even if you rest, even if you walk, if you do any work, if you don't do any work, you'll have a pain. So, but it won't reduce until you release the trigger point. That's the active trigger point. The latent is the trigger point is active, but the client or patient won't feel any pain. So that's latent trigger point. They'll have a trigger. They have a restriction of movement. They'll have they'll have the functional difficulty, but they won't have any pain. Okay, the perfect example for it is infraspinatus muscle in our body, and then your gluteus medius muscle in your body. Infraspinatus muscle, until you touch, even for it's weak for everyone. Okay, until you touch or until you palpate, you won't feel the pain. Okay, that's the ultimate point, ultimate muscle which I can give an example for latent trigger point. The third one is satellite trigger points. As the name signifies, satellite spreads all over the body. So the example for it is, take as a upper trapezius or middle trapezius tightness. They'll feel a pain over this eyebrow, this forehead. This is the satellite. Main problem is over here, but they are feeling over here. And then for QL tightness, quadratus lumborum tightness, the tightness over here quadratus lumborum, but they'll feel it in their hamstrings. They'll feel it in their glutes. Okay, that's the main trigger point. The exact local spot is called key trigger point. The area which is referring is called satellite trigger point area. So this is the major differences. Active trigger point means it will be always active. They'll have a pain while resting, while doing any work. They'll have a pain. The second one is your latent trigger point. They won't have a pain, but they'll have a tightness. They'll have a restriction of movement. The third one is your satellite trigger point, in which they have a pain in somewhere, they have a problem somewhere, but they'll get a pain in the other area. That's the three types of trigger points. Next is types of trigger point release. This is the last topic, don't worry. So we are doing a lot of trigger point releases. The first thing is we do stretches. It's also a trigger point release. By stretching the muscle, the knot will get relaxed. Because we are stretching a lot, it will get relaxed, right? Same thing which is happening in stretches. The next one is there are two things, self and then passive. Self means which you are doing with foam roller, lacrosse ball release, the stretches, active stretches. These are the things which are self releases which you are doing. And then your trigger gun release, all the things. Heat therapy, cold therapy, everything comes under heat therapy, cryotherapy, everything comes under your self release. Okay. The passive one is the release which you are doing to the clients passively. You are applying on them. So there are two variations in it. The first one is ischemic compression. So ischemic compression. Ischemic means it's a reduced blood flow. So when there is a tightness, there is a reduced blood flow to the muscle. Okay, because of the compression of your blood vessel. That's the main reason they get a pain. That's the reason they get a pain also. If there is no blood supply, the muscle won't get enough nutrition or enough nutrients or anything to the muscle, enough protein, ATP, it won't occur, it won't release the muscle. Muscle building is harder. So that's called ischemia. Ischemia means reduced blood flow. So there's one variation, it's called ischemic compression, in which you'll be just holding, you'll find a trigger point, you just hold the trigger point for 30 to 90 seconds. You just hold the exact spot and give a pressure, compress the exact knot, and then hold for 30 to 90 seconds. That's ischemic compression. The next one is your massage. The massage which you are doing, which your clients are doing, that's also kind of release, which will relax the muscle. Why? Because you are moving the muscle, you are making it relax. It's in a contraction state, you are just pulling the muscle fibers. So that's a way of passive release. And then the most common release which you are doing is the cross fiber kneading. Cross fiber friction. So if a muscle length is like this, you'll be moving to the perpendicular direction. If you move along this direction, the good bridge blood supply will be there. Yeah, I agree. But if you take a rubber band, if you stretch it out, if you move the rubber band, or if you pull the rubber band in the diagonal or in a perpendicular way, the rubber band will stretch. That's the normal mechanism for rubber band. Same as like that, our body muscle fibers also is same as like rubber bands, elastic bands. And when it's stretched or anything, if you move it, it will get released, it will get stretched out. So that's called cross fiber friction. So these are the variations of trigger point releases. Okay. And then mainly what we are using over here is ischemic compression, just holding at the exact spot for 30 to 90 seconds. And then the cross fiber friction. The cross fiber friction, when I'm telling you practically, you will know what are the different hands grips which you will be seeing. The repetition which you can do is 20 to 30 reps for each spot. 20 to 30 reps of cross fiber friction can be done. So these are the types of trigger point releases. Self-release are mainly foam roller release, lactose ball release, where stretches and your heat therapy or cryotherapy, everything comes under word there. Your passive release or a stroke, massage comes under stroke. If everyone knows stroking, it's a kind of massage only. Stroking, ischemic compression, as well as your cross fiber friction. These are comes under your passive myofascial trigger point release. Okay. Now I come to the causes. What can cause these problems? Okay. The first one is posture.
Can I pause you?
Yeah.
Can we continue this next class?
Sure.
Yeah. So both you and me, we have time restrictions. I also take 15 minutes. You also take 15 minutes.
Okay, I'm done.
Okay. No. Just saying, it's a beautiful class, but then
no problem.
15 minutes each, because otherwise they're going to hate me for not making them work out.
Okay.
They'll have to finish also by 3. So that's
Can I
it.
just ask one question?
Yeah.